Garamagas, and thank you, Ciarán, and also thank you to the Labour senators for bringing this forward. It is a huge issue, and I suppose I speak from the Roscommon Galway area, and in particular I suppose Portiuncula Hospital, which is in my own hometown. But you know, we have huge numbers presenting at the moment to our ED, for example, and the challenges that we're also seeing an awful lot more presentations of people with addiction behaviours, addiction problems, so with alcohol and with drugs. And that's coming into the ED. And currently, I suppose what I would like to see, I suppose, from the HSE side is that we have different qualities or categories of staff. So we have porters in our hospitals, but you know, our porters are supposed to take on the role of security as well. So I suppose around whether and how the HSE is going to be making sure that our hospitals have the right staff, you know, to monitor this type of behaviour that has increased exponentially in some areas in the last year. And it is not acceptable that our healthcare staff, close to 140,000 now, with increases in the last 3 years, you know, bringing it from what it was originally nearly 110,000 to nearly 140,000 staff now across the country. It is not acceptable that they would need to work already in maybe confined spaces, dealing with people in traumatic situations, I really can't imagine it, and it has frustrated me. So I do appreciate you bringing this motion, and I just think that we do, as you've noted here, I suppose it is something that we just need to look at with the HSE around just the members of staff that would be available there to support and monitor behaviour and ensure that it's tackled. Minister, you'd probably be very aware of this, of course, that we have, you know, like that there's such great increases in staff, which has been such a recognition, I suppose, from the Department of Health, you know, from government as well, in making sure that we have the staff to deal with the pressures we've seen the last 2 years. The challenge is that we're seeing a different type of pressure coming outside of COVID now, particularly, I think, in these behavioural type events that are happening in our hospitals. No one wants to see it. It'd be great if we didn't need to think that we needed to have proper security, but maybe, Minister, you just might speak to maybe the roles of porters and the roles of security staff in hospitals, and perhaps is there sort of a general HSE sort of guidance around that, or what the idea of that would be. The other issue I have that maybe falls a little bit outside of your department, Minister, is that also guards are required to attend to these incidences in our towns and cities across Ireland. In our cities, we've quite maybe a generous numbers of Garda force, although, you know, there's always more needed. But in small towns, that's not the case. And I suppose it is a case that we have to look at the fact that the incidences that are happening in hospitals are having an impact on our staffing, Gardaí staff that are now calling out to these incidences as well. Minister, I know this is not an easy, considering everything that you have tackled in the last 2 years and the supports that you've put around regional hospitals. I very much appreciate that, and what you've done in the CHO area as well around supports for Weststock, and how you've looked to ensure that there's community supports there as well. The area where I do see this as an issue is our hospitals, particularly in towns where they may never have faced this before, but in the last year to 2 years, it just seems there's been a lot higher incidences. And again, perhaps on the CHO side, if there's any consideration around addiction centres, there's one in Galway, I know that you opened recently, addiction centres, particularly in alcohol. In Ballinasloe, we have a day hospital. The addiction centre deals with if you have a primary diagnosis on mental health side before they will deal with the alcohol side. I'm just wondering if there is a capacity there for pilots around centres in addiction studies. It would be very much appreciated, maybe alleviate some of the pressures that we're seeing presenting in the last year. And again, this is just what we're getting from our staff on the ground as well. Gur míle mágad for the time, and thank you, Chair.